So one of the things, Debbie, that we do really differently from other practices is see kids in the hospital from the beginning all the way through.
This is true. And we do this because parents really appreciate having the same doctor see their child from the day the child is born through their growth and development. Most children are uncomplicated. They have a normal hospital course when they're born, and then they come to see us in the office, and we already have a relationship with them. We understand what their concerns are. We're able to alleviate a lot of their fears and concerns, even from the beginning.
Occasionally, even in the newborn period, if the baby has to stay, even for a few extra days, it's a really stressful thing for a family. And even an older child who may have something that from a medical standpoint is completely uncomplicated. Maybe they're just dehydrated from too much stomach virus. It's a stressful thing. The whole family's involved. People are taking off work. Grandma's calling, oh my God, the baby's in the hospital. So it's a big deal. And so we feel like it's really important for them to see their own pediatrician. We're much more able to reassure them, and I think it goes better, and they're able to go home sooner overall.
Another thing is even children when they're older and they have more serious illnesses and life-threatening illnesses and complicated illnesses that need to be admitted to the hospital. It's oftentimes with intense specialists and intensive care stays. We feel that it's very important for us to be the anchor for these families. We've known the children since they've been born, and we're there to answer questions, decipher a lot of the medical advice, a lot of the doctor lingo that parents most commonly don't understand. And importantly too, we've known the family since they were born, and so we can help with the specialists and caring for the children more intimately.
Yeah, and it's becoming more and more common for pediatricians not to come to the hospital. And so especially for kids with complicated illness or chronic illness, it is a good continuous relationship with the pediatrician, because the specialists oftentimes change when somebody's in the hospital for an extended period of time. They see a new specialist every week, but they have us as a continuous force through the hospital stay. And for us, it's very important, and we want to take care of kids in those stressful times and in the fun times in the office for their well checks too.